What is up, y'all? So we have some health news today. This article that I have here is from NBC News, and it's asking what is causing severe respiratory illness in dogs. And surprise, surprise, the article doesn't actually have a good answer, but it has a whole lot of fear, and it wraps it up with the obvious conclusion that people need to get their pets vaccinated. So essentially there has been reported rise in cases of pneumonia in dogs, including young dogs, over the past year, and specifically in places like Colorado just over the course of the fall. So there was actually one part of the article talks about a researcher, veterinarian over in Texas A&M, Dr. Katie, and she said that back in March and April of last year, she treated a lot of severe pneumonia in young dogs, like 1 to 2 years old, requiring even intubation to survive. Basically, their lungs were so bad, but she actually noted the fact that these were vaccinated dogs. Some of the symptoms that they want people to watch out for is like cough, sneeze, red eyes, watery eyes. But I thought it was interesting, and then I'll finish talking about the article, but I thought it was interesting that their whole conclusion with this article is that the issue comes from people having distrust and no longer wanting to vaccinate their pets. And then they absolutely have nothing to support that whatsoever. So first of all, we have this doctor here who's saying that the pets that she saw were actually all vaccinated. And then we have a lot of other people, which I'll talk about in a minute, where it doesn't look like there's any real known pathogen. They don't know exactly what they're looking for. There's probably not even a vaccine, that would cover the pathogen. So it's very bizarre that they would come up with that as the conclusion of this, fear-based article that they're trying to sell us, that there's a dog pneumonia going around. So they did talk about the same tactic that they're using to support the idea of vaccinating all your dogs is what they do with people. And they say that the dogs have a tripledemic, and that dogs are all getting dog influenza, which I didn't even know was a thing until a couple of years ago, bordetella, and then mycoplasma pneumonia, which is kind of interesting because that's actually responsible for some of the pneumonia cases that they've been reporting in people now, this white lung and this atypical pneumonia. I believe those are all linked to mycoplasma pneumonia, so it's kind of interesting. And that's always been around, but for whatever reason, it's either more frequent or there's just like a spotlight on it right now. So in people, the tripledemic that they're talking about is, I believe, COVID, influenza, RSV. So they have that to scare you about why you need to get all your vaccines for people. And then they have this dog tripledemic that they are going to scare you with to get all the vaccinations for your dogs. But like I said, the pneumonia that they're seeing isn't any of these diseases, and I'll continue on about that. So some of the places that they've had a rise in these pneumonia cases in the dogs is Colorado, California, Florida, Georgia, Idaho, Illinois, Indiana, Pennsylvania, and Washington. And I thought that was interesting, especially because if you kind of trace a lot of those places up along the top and even down the sides, they're all a little bit more affluent of states compared to like my state, like Louisiana. It can't necessarily just be a demographic thing as far as a geographic thing, as far as like sunshine, because we have Florida and we have California on the list. So what I'm thinking is that, and I always like to play, we're going to put our like tinfoil hat on right now because we're playing conspiracy theorist. we already have Dr. Katie saying that her pneumonia patients, these young dogs, age 1 and 2 years old, that were like crashing and having to go on the dog ventilator, were vaccinated. And these states that I'm pointing out to you are states where people, in my opinion, seem like they're probably highly more likely to vaccinate, like Washington State, where I'm originally from, California for sure, you know, Colorado also, Idaho, I would assume. So I'll have to wonder, could this pneumonia be either like a reaction to a vaccination, something getting into the animal population from a vaccination? Could it even be shedding of, you know, people who have had like a RSV vaccine or COVID vaccine? I don't know. I'm just hypothesizing here, or guessing, I guess, but it's interesting to think about, and y'all let me know in the comments if you have any thoughts there about what could be causing this in dogs. So in New Hampshire, at one of the universities there, they did think that they found something different that obviously there wouldn't be a vaccine for because it's brand new, and they're excited about this, but it's very odd. So basically, they're saying they think they found a novel bacterium in these samples of 30 dogs. They found it in like 21 out of 30 of the dogs. Samples, which these articles are just mainstream news articles. I have no idea what they sampled. You know, were these blood samples? Were these respiratory secretions? We don't know. But what they did say is that they found this same genetic material, and that was about all they categorized it as, in 21 out of the 30 samples. They said it was a funky bacteria. It was smaller than normal, had a smaller genome than normal of a bacterium, and it really doesn't even sound like they found like a whole living bacterium or organism. They just kind of found some genetic material. So kind of interesting there. Again, leads me back to, you know, was this a contaminant of a vaccination? Was this a shedding thing? You know, whereas like my body is starting to make some, say I got an mRNA shot, or even one of those monoclonal antibody RSV shots, my body starts to, you know, remake those things. I'm shedding that genetic material over my dogs. Like, you never know. You know, this is the questions we want to ask, but they don't want to ask. So they said that these dogs had all been negative for bacteria, viral, and all the known fungal illnesses. Basically, they hadn't found anything like in common with them. Some of the issues and that was actually a separate article. If you bring up the original NBC News article, that one was a linked article from November. So this has kind of been going on for a little bit. And whether or not it's really a huge concern, I don't know. Or are they just trying to scare us into getting our dogs back into the vet to get vaccinated because they see that the trust has broken down, we aren't going to be consuming those products anymore, and they want to amplify the fear so that they can get our money and that they can bring us back to the system because we're so scared. So one of the things that they said was that these dogs are presenting with tracheal inflammation, acute or chronic pneumonia. So either it could be like a very fast pneumonia that is basically hitting the dogs really quickly and they're going downhill fast, or it could be kind of a chronic lingering pneumonia. Same thing with cough. But again, the take home that they have for us is that we need to get those dogs in and get them vaccinated, even though we've already talked about Dr. Katie in Texas A&M, her dog sample of, you know, her cluster of cases, they were vaccinated dogs. They haven't found anything with these dogs that indicates a, like, you know, vaccine related illness, but that's what they want you to know, you know. So I think it's kind of telling there. They don't really have any answers, but all their signs point back to you need to get more shots. Moving on, I wanted to talk about something that I posted over on Twitter that was highly disturbing to me. For those of you who don't follow that girl Casey, I like her. She is a pretty cool content creator. She's relatively new YouTube channel. I think when I had first found her YouTube channel, she had probably less than 500 subs, and now she's at like 1.2 I think thousand. So she's pretty cool, but I'm gonna talk about this what vax do they want the dogs to get? They want the dogs to get all the vaxes. They're saying that they should all be vaccinated, fully vaccinated. That's what it always comes back to. And I think it's kind of funny because, as y'all know, I have some natural animals at my house, and I've almost come to realize that pretty much everything they tell us about animal health is just as big of bunk as human health. Basically, they tell you that if you don't, and this will actually segue us into what I was going to talk about for a second, but they basically tell us if you don't like castrate your dog, that your dog's going to be mean, aggressive, and pee everywhere, which is not true. I learned this by accident because I had a dog a few years ago that I got. He was already a grown dog. His name was Max. He was an unneutered Great Dane, and I will tell you, he never peed in my house, and he was the sweetest dog I've ever met, and that was like a mind blow. So Dave, as you all know, is a natural man. He's he's a natural male dog. He's grown now. He's actually fathering some puppies this week, hopefully, with his lady dog. And Dave is not aggressive. Dave does not pee in the Dave never pees in the house. He's the most potty trained dog I've ever met. He's the most confident dog I've ever met. He's the kindest dog I've ever met. He has a lot of energy as a young man dog. Liberty, on the other hand, my natural female dog, who is unaltered, sweetest, kindest, calmest dog I've ever had. I had a female dog in the past that I spayed her and she became like aggressive. I had a male dog in the past that I neutered and he became fearful. So all the things that they say are kind of lies, in my opinion. Unaltered dogs live 2 to 3 years longer than neutered. I would agree with that, and I'm sure it's true. So anyways, what I was going to say is everything that they are going to say points back to, you should, take your dogs in, you need to get them altered, you need to get them vaccinated. And that's what they want for you, because they want you to get it a microchip too. And then what they do, and they want to euthanize it when it's old, okay? So what they do to the animals, they also do to the people. So there's a tripledemic for the dogs, there's a tripledemic for the humans. They want to alter the dogs and neuter them, and now they want to castrate humans. So back to the story that I was talking about from that girl, Casey. Check out her YouTube channel. She had a clip that she shared that I just happened to click on the other day, and it was talking about gender nullification. The most heinous thing I've ever heard. This is worse than transgenderism, and it's actually a real thing, and they're doing it in California. It's absolutely disturbing. And she shares pictures and videos from the website, like on her video. When I shared about this on Twitter, I cropped that part out because it's just too much for me. But if you want to see exactly what they're doing, go over and check it out. They have these clinics in California, and basically that was the only place I really saw them pop up when I tried. It's so wild that this is still streaming. My phone overheated, but apparently it would still stream the whole time. So anyways, I have the phone now, and now you can't even hear me talk because I was blasting on it. The air conditioning. So basically, they call this, and I don't know if my phone's going to just shut off again, but they call this gender nullification, and basically they just remove the genitals of the person, and then, I guess just send them about their life with basically nothing down there. It's pretty disturbing, and I have to question how medical boards find this ethical to perform these procedures, and how that this is an accepted form of therapy. So I don't have an answer to that, because I tried to search over and over. As somebody who used to practice medicine myself, I like to believe that there really is a basis for how they determine what's ethical. And even here, the state board in Louisiana, if you're going to look at the ethics of doing something I think I've seen this on the website for the medical board here in Louisiana about the usage of ketamine for depression and stuff like that, they have an opinion on that, even if it's considered acceptable from, maybe the AMA. They're going to have their own opinion. And I find it really hard to believe that I couldn't find, the opinions of the AMA, the opinions of the California State Medical Board, anything on this extremely disturbing surgery where they're basically just removing the person's genitals and leaving just like a hole there. Basically, there's nothing down there. And, but this is something that they're actually doing in California. So they call it gender nullification. To me, I call it, human abuse and mutilation by doctors. And yeah, why would any doctor even do that? I have no idea. It's how the medical boards can accept that as, considered care. I can't understand how the AMA, how the American, Association of Surgeons, whatever it's called, how can they consider this care of a human being? I have no idea, because there's basically just plain old, they're like literally mutilating the person. So that brings me back to my questions when it comes to modern healthcare. With, at what point do we see what they're doing to some people and we realize that there's not really any role for them to help us? So when I think about this personally, I had a talk, like a back and forth. I have a back and forth with this doctor over on Twitter all the time. But he basically said that, I said something about how can somebody be pro-abortion, and he said I'm pro-abortion and a pro-addict, meaning that sounds like he, in addition to working in, I believe, an emergency room and as a toxicology expert, he also performs abortion. So in my opinion, how are you going to perform, something like ending a life on a human being, and then I'm supposed to trust you if I have to go to the emergency room? Same thing, especially with like a GYN who would perform abortion. Like, how am I supposed to trust you with my baby's health when you're also aborting other people's babies? Like, to me, it just doesn't pass the gut check. That's not a healer or somebody that I want around us, providing us care, because they've already shown, that they have no respect for human life. Same thing goes with these transgendered doctors that do things like these nullifications and everything. And just their colleagues. You might never see a doctor who does those surgeries because they pretty much only maybe practice in that way. Although some of them are like urology specialists and everything. So are you going to want to be cared for by that doctor who also goes and performs these mutilating surgeries on someone else? Their standards are so low, No, they don't have to do an abortion if they mutilate the people. No respect for life. Well, both is bad. That's what I'm saying. So at what point do we say, like, these people aren't really providing health care to us at all? They're basically essentially just providing, whatever services that will make them money, I guess, and bring them more customers over time. There's not a lack of caring for the individual if they're performing these mutilating surgeries and they're also doing things like abortion. And because of that, I think there'll be a huge loss in faith in the profession as a whole, because like I said, even if your doctor's not the one performing these surgeries, there's still a person who is, sitting next to these people at, say, like, their medical conferences. They're chums with them. They went to school with them. They're all one, profession, basically. And they have to ascribe care, like, the way that medicine works now. Say if I'm just a GP or something and somebody comes into me, we're in California, and they feel that they want gender nullification and things like that. The way that it's going to work is as that GP, they're going to be referring them to that specialist who then is going to perform that care on them. They don't really get to say, ethically, I think this is a wrong move for you. That's not how it starts to work. And so we have to remember that they all work together, and no matter, you can't really say, you know, none of them are really going to have ethics. Like, they don't really have the ability to do that. They have to follow standard of care. So if you're in California and standard of care, which I think they've even made laws now to where it's for children who want these surgeries or whatever, like, it overrides the parent. And so same thing is going to happen with a practitioner. You know, if you go into one of these practitioners and you're confused about your gender, who are they going to be referring you to? They have to support the system. So in my opinion, one's become just as bad as the other. There can definitely be times when you need like emergency care and stuff, but it's pretty scary in this day and age, you know, with the way that they are you know, performing these surgeries, validating the fact that they exist. You know, like, the ethics to me are that original do no harm. There was also a doctor on Twitter who told me that that's not even a thing anymore. You know, there is no do no harm at this point. They say they try to just harm you as less as possible. Then they have all type of mental ways that they you know, go ahead and tell themselves why certain types of harm are fine. So I'll probably delete the end of this part because it's after that long pause, or I might chop it up and reshare it all. But thanks everyone who tuned in. Sorry that my live stream dumped out in the middle because, I don't know, my phone overheated, but for whatever reason it didn't stop recording. So y'all have a fantastic day. I'll be back with more health news tomorrow.